This is a quick start guide for use of the Philips monitor when doing vital signs and helping on a patient. First, let's look at the equipment you'll need to make sure you have on hand to do the vital signs. If your patient is attached to an EKG monitor, the electrode should already be in place and attached via this cable to the monitor. If not, all of this can be found, the electrodes, for both pediatric patient this size or the small neonatal size for an infant in the clean room. Appropriate size blood pressure cuffs should also be used. They should be at the bedside already, but can be found in the clean room. Choosing the cuff is based on the weight and size of the child's arm to make sure that it correctly fits. And our pediatric smallest cables will be needed for our infant cuffs. Those adaptive cables are found in all of the patient's rooms or in the clean supply rooms. The next item will be a pulse ox probe and a cable to attach that to, which also should be in the room in addition to the thermometer. When you approach the monitor itself, if you touch the screen, it will wake the monitor up. As you can see, when the monitor wakes up, you'll have whatever has been last hooked up and used on the patient coming up. So the green line will be the EKG cable at the top. The next line will be the respiratory rate. Blood pressures will appear here by the NIBP, and if a pulse ox cable is hooked up, you'll see the pulse ox reading also. In order to take a blood pressure cuff, all you're going to have to do is hit the start-stop button here. It will cycle through after you've applied the cuff and take the blood pressure of the patient, which will appear in this area. Please make sure that you're holding the arm still or the leg still during that monitoring so that it doesn't get as tight as it would need to be. The first time is always the tightest when it takes it on the patient. At the end of getting the vital signs, or if it starts beeping while you're in the midst, you can always pause the alarms by pressing this button. It'll stop the beeping while you're hooking something up. You can acknowledge alarms by pressing the button directly there if you get a high alert or your blood pressure is too low or too high, if you need to retake something for some reason. And then to place the monitor back in standby when you're done, you won't go ahead and discharge the patient, just hit monitor standby, and it'll immediately revert to just the hold screen.